surgery remains an inherently male-dominated profession. In a recent survey, 22% of female surgeons were reported to perceive a glass ceiling in their training. We want to change the way people think about women in surgery and show students that surgery is an exciting and accessible career regardless of how you identify. We are Bristol WinS, and this is 22 Questions with. Ms. Shelley Potter is a National Institute for Health Research clinician scientist and consultant senior lecturer in oncoplastic breast surgery at Bristol Medical School. Aside from providing high-quality, evidence-based care to her patients in North Bristol, Ms. Potter is passionate about improving outcomes for patients through collaborative research. She has extensive experience leading on high-impact research projects, including the BRAVO study, which was published in the British Journal of Surgery and culminated in the development of a core outcome set for reconstructive breast surgery. Thank you so much for taking your time out of your busy schedule to talk to us and for agreeing to be on the first episode of our series of 22 questions.
No problem.
We're going to start with the first question. So it's pretty simple. So what was the first thing you did this morning?
Fed Frankie the cat.
And what's something you've recently learnt about yourself?
That I'm more resilient than I thought I was. It's been a very frustrating time, and there have been lots of delays in my research, and my research is one of the most important things to me. And somehow I've managed to just deal with the fact there have been huge delays. So yes, I'm surprised at that.
What were you like as a medical student?
Incredibly boring. I was a really serious medical student. I was really focused on sort of performing really well in my exams, prizes and things. And it wasn't until I actually graduated that I realised there was more to life than work.
And following on from that, if you could go back in time, what is one piece of advice that you'd give your medical student self?
Relax a bit. Have some more fun. Not everything's about work.
So going on from that as well, what is the best piece of advice you have ever personally received?
I think it's be yourself, because there's a lot of pressure to sort of conform to the way people expect you to be. And I've been told, oh, you don't look like an academic, you don't look like a surgeon. But actually, I do look like a surgeon because I am a surgeon and I am an academic. So I remember someone telling me I needed to dye my hair and wear glasses and look more serious. And I've never felt the need to do that. There's nothing a girl can't do in Armani and Louboutins.
Absolutely. And who is the woman that you admire most?
I think in terms of people locally, Debbie Sharp, who's Professor of Primary Care, is an amazing woman. She leads by example. She's absolutely fantastic. And sort of more historically, people like Marie Curie, who just weren't afraid. They just did exactly what they wanted. And I think that's a really good message.
Some say that medical education and the hospital environment disproportionately reward stereotypically masculine traits above feminine ones. Do you think this is the case?
I think it used to be. I think you had to be seen to be very male. But if you're a woman and you behave like a man, you're not thought of very favourably. If a man is sort of asked the nurses to do things, or is I don't know, they're masterful or they're confident, whereas if a woman does it, they're arrogant, or the same sort of traits are seen negatively in women. So I think women have to behave differently. It shouldn't be that way, but you do have to behave differently and work differently. And actually it makes you a better doctor, because you are a better collaborator, you work better as a member of the team. You don't expect anyone to do things for you. So I think things are very different between men and women, but I think we both bring something different, and that's good.
I couldn't agree more. There's a lot of talk about sort of surgical culture. What does this term mean to you, and has it shifted since you were a trainee?
I think it has. For me, surgical culture means people working together to deliver high quality care. And I'm very lucky. I'm a breast surgeon. The vast majority of my colleagues locally and nationally are female. It's a very sort of patient-centered specialty. So for me, surgical culture is a very positive thing. But from my experiences during training, I know that's not always the case. And I remember being an orthopedic trainee, and it was just the most horrendous experience. But I'm hoping things have moved on quite a lot since then.
So why did you choose your particular surgical speciality?
Breast surgery is very, very holistic and very, very patient-centered. When I was a surgical trainee, I really enjoyed pediatric surgery. I thought it was really challenging. That was very patient-centered as well. But in terms of what I wanted to do long term, pediatric surgery doesn't really allow you to balance things in the same way that breast surgery does. Breast surgery is academically challenging. It's technically challenging in that we do lots of oncoplastic and reconstructive procedures, so it's very varied. We have very good patient outcomes, and it is very patient-centered and very holistic and team-based. And that's why I enjoy it, because you can make a huge difference to people's lives.
I guess following on from that, you've mentioned some of the challenges in your specialty. What would you say is the most challenging thing, or the thing that you found personally most challenging?
I think one of the most challenging thing is that we tell women very frequently they've got breast cancer, and breaking bad news, no matter how many times you do it, never gets any easier, particularly if you have young women. And at the moment with COVID, we're seeing a lot of women presenting later with involved nodes, and personally I'm finding that incredibly challenging. And
going on from that, do you have any advice for someone who wants to get into your subspecialty?
Go for it. At the moment, to be a breast surgeon, you need to train in general surgery, but that is imminently going to change as of next year. Breast surgical trainees are going to be allowed to come off the on-call rota at ST6, and there's a move to try and make breast surgery its own specialty. But it's a very rewarding specialty. It's also the type of specialty that you can combine with teaching or management or research, and it's very fulfilling and offers lots and lots of opportunity.
What's something that people don't know about being a surgeon?
I think how much of a team sport it is. That you, as the surgeon, you're the one who's meant to be in charge, but that's not the case at all. We couldn't do anything without our breast care nurses in clinic. They support the patients. They're there when we're not. In theatre, yes, we do the operating, but there's a whole team. And I think the whole team side of surgery is very overlooked. As a surgeon, you are a part of a team. It's not all about you.
Do you remember the first operation where you were the lead surgeon?
I do. I was a house officer, or an F1 as it is now. It was an incision and drainage of an abscess. And the SHO that I was working with photocopied the operation note and gave me a copy. I think I'll always remember that.
And you've achieved so much in your career. Would you say that you're ambitious?
I'm phenomenally ambitious. I'm incredibly driven and passionate about research, about trying to transfer what I'm learning, what I'm doing in my research into my professional practice, and the two complement each other. So yeah, I'm incredibly driven, and that's probably not necessarily a good thing all the time.
So potentially the next question might be a bit too simplistic in terms of, a very complicated career path, but what would you say is your best career move?
Moving away to do my fellowship. So I was very lucky. I was born in Bristol. I went to Bristol Medical School. I did all my training in Bristol. I was an anatomy demonstrator. I did my basic surgical training, which is now core training, and my PhD, and then my higher surgical training was all here. And it was all very nice. But I moved away from my fellowship, and that was one of the best years of my life in terms of I learned a lot. I met different people. I saw a completely different way of life. And it's really nice to move outside your comfort zone. I think that's a really good piece of advice, and probably my best ever career move.
So on the flip side of things, can you talk about a time that you failed and perhaps what that failure has taught you?
Oh goodness, when I first started doing research, everything went incredibly wrong. I made some very bad decisions, just through naivety and not doing my own research and working out what was good and what would be useful in terms of what I wanted to achieve. So that taught me that you need to do your research. You need to really look into what you want to. Really need to look into what you want to do, and not just believe what you're told, because it's very easy to be misled, and not everyone has your best interests at heart. So if you want to do something, by all means, but make sure you're going into it with your eyes open, and you're not doing it for any reason other than because you want to.
So the next question is a bit more abstract in a sense. So the author and surgeon Atul Gawande once wrote in his book, surgeons believe in practice, not talent. Do you agree?
I was once told you can teach anyone to operate. So I think the technical skills can be taught. Some people will always have flair, and things such as breast surgery, you have to have, I think you can develop an aesthetic eye, an eye for the way things look. And I think that depends on what specialty you go into. If you do colorectal surgery, for example, probably an eye for the aesthetic is not as important. But for something like breast surgery, where you're looking at shapes, looking at forms and trying to make things as good, there is an element of that being inbuilt. But in terms of the technical stuff, you can absolutely learn the technical stuff. And I fully believe that surgery is an art. There's a science to it as well, but it's an art.
So if you were not a breast surgeon, or maybe even not a surgeon at all, what career path do you think you would follow?
My ideal job would probably be in fashion or in films. But if I wasn't doing any of that, I would probably have gone into law.
There has been a consistent rise in the number of doctors publishing first-hand experiences of working in the NHS, so like a peek behind the curtain, so to speak. Would you ever write a book about your NHS war stories?
I suppose never say never. If I thought it was going to help patients in some way, then potentially. But I think I can make more of a difference through my research and the findings that way, and I can change practice and improve outcomes for patients through that side of my work, rather than the horror stories that I have from my surgical training.
And perhaps moving away from your own writing, what's one book that's made a lasting impression on you, maybe medical or not fiction or non-fiction?
I read Adam Kay's This Is Going to Hurt, and it's last year actually, before I went on holiday, and it was exactly the way my training was. And I didn't realise how hard it had been until I reflected on it. So that left quite an impression. I think it made me remember to be kinder to people coming through, because it is really hard and it is really challenging. And it was quite nice to have that reminder.
This is more of a selfish question for me and Amy as future aspiring surgeons. So if you could change one thing about surgery to improve like the future female surgeons' experience, what would it be?
I think it would be more people working less than full time. It should be normal that you don't have to train full time. It doesn't matter what the reason is. In the later stages of my career, I didn't train full-time clinical. I was doing half and half, clinical and academic. But you should be able to combine surgical training with whatever you want to do, especially if that's sort of family, or whether that's because you're a sportsman or because you're an academic or for any other reason. I think if that was more normalized, that would be good. But I think things are changing and it is getting easier. And I think a woman's place is in theatre. Absolutely.
And our final question, as part of these 22 questions, is what are you still learning?
How to get the most out of people. I'm very, very driven, as I've said, but it's learning that not everyone is, and that everyone has different things that motivate them and that are important and meaningful to them. By helping people to achieve what they want to achieve, it helps you achieve what you want to achieve. And I think I'm still learning that. I'm still learning how to develop a team. I'm learning how to sort of grow the team and get the most out of people. But I'm hoping I'm getting better.
Thank you so much for answering our questions.
Yeah.
Yes, I've had a slightly bumpy path in places, but I think no matter how bad you think things are, and things got pretty bad, there's always light at the end of the tunnel, and you will get past it.
It's hard to imagine as well, because like writing your bio, having a look through all of the things you've achieved, it seems very seamless, and it seems very kind of not easy, but incremental hard work that just built on itself.
It's very easy to see the good bits. So before my fellowship, for example, I got told, 2 weeks before my fellowship, I got told I couldn't go because I didn't have enough Hartmann's procedures. And then, so there was everyone actually rallied around me against the training program director. And it happened in the end. But that was incredibly stressful. The other thing is that I believe that a lot of things do happen for a reason. And if things are difficult, you often come through them and you've learned something. You may not have enjoyed that experience, but you've learned something. You've learned a new way of working, or you've learned something about yourself you didn't know before. So I think good things happen in some quite unexpected ways, but don't be put off with hardship. I've had several things that have gone very drastically wrong, and I've still come out the other end.